believe that the Lagos State government is truly special and commendable because of its numerous efforts over time to try to track health indicators in the state. In my own mind, and I stand to be corrected, if you do a quick search of literature, it will show that no other state has been able to fund projects that would x-ray the processes of the services provided by the state. I think Lagos State deserves a round of applause.
You can't fix what you can't count, and you certainly can't fix what you don't understand. So you call those who know. One of such problems that we have that certainly we've not been able to fix, and I'm glad Professor Falabi took us that historical route of, we've been talking about this thing forever. Maternal mortality is almost like it's now business. You know, like if you just stay there, your public health or global health career, you will make it. But that's how long we've been trying to fix this problem.
The quantitative data was mostly about numbers, and it included the maternal death count, the live birth count, pregnant women who were pregnant at the time, and the verbal autopsy.
LVASA is like the precursor to LVASA. Majority of at the beginning, we had to have a lengthy discussion, and LVASA leveraged the systems that have been put in place for LVASA as well, but improving it, in terms of the robustness and the technique as well. The mapping and listing, training of data collectors. Yes, I left your mandate because I didn't want to go in depth. Today is for LVASA and not LVASA. That's why I sort of humbled in the middle of my presentation, so I'm not going to town about what we did when we had LVASA as well.
I also want to add that, as you all know, in the primary healthcare setting, I know Dr. Wayemi is here, she's primary healthcare, but the permanent secretaries play a crucial role because primary healthcare has been divided into districts. And as I was sitting down listening, I just realized that, okay, this is really good because you went to all those 20 local governments. And that way we can actually focus on the districts, because we have districts 1 to 6. We can focus on the districts, as in, this is what you need to do. You're having more deaths, maternal deaths, than maybe district 6. Maybe they don't have a lot of women who are in their productive years. So it actually helps us when we're making decisions, and also when we're doing our budget, which is coming up soon in the next few months. What budget to give to district 1, 2, based on all these things. That's how important this is.
Now imagine carrying a bulky hard copy to over about 50-something pages. It will waste time. It's not really efficient. So we have to build in. There are skip patterns. Fine. This is on Kobo Toolbox, so we have to build in skip patterns. So, for example,
another key question: where did she die? And these are the available options: home, private hospital, public maternal home, and all of that. So they tell us where she died and her nationality: Nigerian, non-Nigerian, Nigerian. Next.
Let me say 160, 170 data collectors. Let's say 170 data collectors. When we started, there were just 88 of them. When we were on the paper maps. When we moved to the digital map, we had larger areas, so we had more. And they were all trained, both physical, online, kept on monitoring, on mapping and listing how to conduct verbal autopsy. A selected few were trained on how to collect social autopsies because they are both different. And then we also trained them on grief management.
In the case of physician's determination, we have clinical judgments. It's very important, and that is very well utilized. And then cues that are not captured by the VASA verbal autopsy interviews are usually integrated by the clinicians. And then the diagnosis often aligns better with the true cause of death. Whereas we have limitations. These limitations include that it is time consuming. Imagine 4 obstetricians sitting to review 61 cases of maternity. That takes a long time. And then you have fatigue can set in, limited number of physicians. We don't have the luxury everywhere to have it. And then you need to train. Even if they're not obstetricians, the physicians that you are getting from public health, other fields, need to train them. So that's going to be costing them. We are going to.
After you have geolocated, then you start the questions proper. And you ask questions from about the woman, her age, her education, and then starts to ask that, did she have fever? Did she have a headache? Did she have neck stiffness? It's looking at all forms of disease.
Please help me clap for all those from Lagos State government who have been with us throughout this journey. And just for the record, they were not attached researchers. They were co-investigators who were together throughout this entire process. And I heard when many of them were introducing themselves today, they actually said, I'm a co-investigator on LVASA-SRS. So thank you very much for your service. We're really grateful.